I call the member for Fisher.
Thanks, Madam Deputy Speaker. Well, you know that the Labor Party are in trouble when they come into this place and start spruiking about Medicare and start running the age-old trope that the coalition is anti-Medicare. You know, they ran Mediscare in the campaign of, what was that, 2016 or 2019, which turned out to be absolute rubbish. We even had to introduce laws to try and prevent them from doing it again, but clearly that didn't work, because here they are again trying to do a big beat-up about Medicare. Now, Madam Deputy Speaker, I don't know about you, and I don't know about other members in this place, but the last time I went and saw a GP, it cost me a significant sum of money for me, and I earn good money, a significant sum of money as a co-payment. So those members opposite talk about them strengthening Medicare, but when they came into government, Medicare bulk billing rates were at 88%. Do you know what they are now? They are at 77%. That is a big, fat fail on the part of this government. But one of the things that upsets me the most about this government's failures is it the fact that they were 18 months late in establishing a Headspace in Caloundra when we had promised to do it when we were in government. They were 18 months late in opening Headspace. That was a big problem for me and a big problem for young people. It took me and a concerted campaign to drag the health minister kicking and screaming to instigate a Headspace in Caloundra. But that's not it. That's not the big problem that I have. The big problem I have with this government and healthcare, and I want to welcome members from the other place into the chamber right now, because it is in relation to the care of how we deal with people with mental health problems and mental illness. Years ago, and thankfully those days are gone by, we stuck people with mental health problems in sanitariums and asylums. We removed them from our site so we didn't have to look at them. Thankfully those days are over, but the treatment and care of people who live with mental health problems in this country is nothing other than an absolute disgrace. This current health minister does not get mental health. I'm going to say it again. This current health minister does not get mental health. You know who did get mental health? The former health minister. The former health minister, the former member for Flinders, Greg Hunt. He was an outstanding health minister and changed the way that we dealt with not only funding but the treatment of people with mental health conditions, whether it be very, very significant or mild. I have lived through the mental health sector personally as a family member, both in the public sector and the private sector. And the way that this country cares for people with mental health problems is an absolute disgrace. If it was any other type of illness, people would be marching in the streets. They'd be holding demonstrations. But because it's in relation to mental health, we don't want to talk about it. We keep pushing it and shoving it under the carpet. If a person comes up to a public hospital with a significant mental health illness, they are basically put on suicide watch and released into the public a couple of days later. It is an absolute disgrace, and this Health Minister needs to step up.
Authorised by Andrew Wallace, LNP, Boccarina, Queensland.